So, once upon a time there was a war. Here, you refer to it as the 7 Years' War, even though it lasted 9 years. Because apparently the first 2 years in North America, when British soldiers were fighting French soldiers, but doing it on that side of the Atlantic, apparently that doesn't count for some reason. Right? During that war, Britain lost about 1,500 sailors to enemy action and almost 100,000 to scurvy. The dead from scurvy would have been the third largest city in England at the time. So, has anybody here ever seen pictures of scurvy? Okay, there's a reason I don't put a picture in the slides. Your gums and your fingernails go black, your teeth and your fingernails fall out, the hair starts to fall out, and then the bad stuff happens. All right? It really does look like you're rotting alive. Those pictures you see in the movies of the zombies, those are people with scurvy. Okay? Yeah, put that picture away. The look on his face, yeah, just turn that off, okay, please? We don't need that. Yeah, we don't need that. Okay? Scurvy is a vitamin C deficiency. If you're getting fresh fruit and vegetables, you don't get sick. Okay? Seal blubber, it turns out, is rich in vitamin C, which is why the Inuit didn't get sick. There's no fresh fruit and vegetables up there. Right? The irony is, a Scottish surgeon named James Lynn had figured out before the war started how to cure scurvy. You see, what he did was he looked and said, if we pickle vegetables, they don't rot. So why don't we pickle the sailors? Okay, it's a little bit impractical, but at least he's got an idea. Scurvy looks like rot, right? It's called sea rot in some places, right? So he said, let's take 12 sailors, split them into 6 pairs. 2 of them get cider. 2 of them get vitriol, which is a weak solution of sulfuric acid. Bad day to be those guys. 2 of them get vinegar. We're pickling them. 2 of them get seawater as a control. He didn't call it that, but he had the idea of, let's see what happens if we don't mess. 2 of them got oranges and 2 of them got barley water. Lo and behold, the ones who got oranges got better. The others got sick and died. Some of them did anyway. Right? And it only took a few days. It only takes a few days to completely eliminate the symptoms of scurvy if you're getting vitamin C. Now the problem was, because he was Scottish and a commoner, the British Admiralty ignored it until the early 1700s, when the experiment was repeated by a proper Englishman with a hyphenated last name, just in time for the Napoleonic Wars. And you don't have to walk very far from here to find historians who will tell you the fact that the British fleet could stay at sea months at a time with men who were still able to work was one of the decisive factors in that war. This is a non-trivial result. Okay? But it took a long time, a really long time, for medicine to get their heads around the idea of maybe we should be a science. In fact, Lewis Thomas had a book on the history of medicine. It's called The Youngest Science. It's not really till the 1920s that any medical school, anywhere, is teaching doctors to be about the scientific method and about experiments. Biologists are doing it. Louis Pasteur and others had made it impossible for anybody to be taken seriously as a biologist if they weren't doing proper science. But it took almost, 2 generations for that to percolate over to medicine. One of the turning points was the Hill and Dahl study in 1950. Okay. You probably don't know this. I'm going to carefully avoid making eye contact with the smokers in the room. But prior to the First World War, lung cancer was so rare that individual cases would be written up as journal articles. By the 1920s, it was an epidemic. We know now that was because during the First World War, millions of men switched from smoking pipes to smoking cigarettes. You're in the trenches. It's easier. But at the time, people didn't know. Is it because of tobacco? Is it because of automobiles? In the 1920s, we're also seeing an explosion in automobile ownership. Clearly, they're pumping smog into the air. Is it something to do with that? It's plausible. We're breathing that stuff. Our lungs are rotting. Right? Is it something to do with electricity or radio waves? There's a school district in Canada which has just banned cell phones because they give you brain cancer. Right? They don't. Every scientific study we've done has said there is no risk. But you can understand. People are faced with things they don't really understand, and they're seeing something else happen. Correlation must be causation, right? All of a sudden, homes have radios. There are power transmission lines overhead. Is that why we're getting lung cancer? Right? In 1950, Hill and Dahl started a case control study. And it's called the British Doctor Study. That was their first run. They then went back and did a much larger one. They said, we want to track a large population over a long period of time. Who will stay enrolled in the study? Not just this year and next, but decades. So they went to the British Medical Association and they used as their test subjects doctors, because it's a relatively homogeneous population. It's white and male. Right? It's 1951 in England. Right? They have to be registered with the BMA to practice, so we can follow them when they move, even if they forget to tell us. This is important for long-running studies. And some of them smoke and some of them don't. Plus, they have a professional interest in the result. They're more likely to take part. That study actually ran until 2001, when the last of the subjects finally passed away. There's 50 years worth of health data on almost 15,000 white males. It's still being mined by lots of people. So, what did Hill and Dahl find out? Number one, smoking causes lung cancer. Right? Absolutely positively. 20 years of tobacco companies buying ads and bribing people to say there must be other causes, notwithstanding, smoking causes lung cancer. Number two, many people would rather fail than change. There are smokers in this room. You know this, but you're smoking. Okay? The more interesting thing for me was the reaction of the medical community. This is the president of the British Medical Association. When asked about the results of the study, he said, what happens on average is of no help when one is faced with a specific patient. He's right, but he's completely missing the point. Okay? It wasn't really until the 1980s that there started to be a really big push for what is now called evidence-based medicine. And one of the turning points was 1992, when Sackett coined the term evidence-based medicine. He did the studies in the 1980s that showed that with wide error bars, anywhere between a quarter and a third of what GPs were prescribing for patients had absolutely no effect, one way or the other, on the patient's health. Why did they do it? Because that's what they've been taught to do. Why have they been taught to do it? Well, because their teachers have been taught to do it. There wasn't a tradition in medicine of, can we refer this back to some sort of grounded study that tells us it has an effect? We don't even have the data. Well, we've come a long way. Today, randomized double-blind trials are the gold standard in medical research in many other places. And as scientists, you all sort of understand those words and why they have to be there. If you're interested in this stuff, by the way, check out the Cochrane collaboration site, cochrane.org. They have pulled together tens of thousands of chunks of information about what works in medicine. Raw data, published papers, comparative studies, review studies, and it's all publicly available and well indexed. Coming back to varicose veins, there are two, well, at least in North America, there are two basically different approaches for treating varicose veins with surgery in elderly patients. Which one's more effective? The raw data is there, so are the analyses. Go and have a look, figure it out for yourself. Now, is the average person going to do it? No. Will a newspaper reporter do it? Probably. Should a grad student? Absolutely. This is wonderful.